Brittany Barber, a postdoctoral research fellow in Halifax, Nova Scotia. I'm currently a Canadian Institute of Health Research funded Health System Impact Fellow, working as an embedded scientist at IWK Health, which is a women and children's hospital, and an affiliated scientist at Dalhousie University. I want to thank JBI for the invitation to share the research our group is leading from Dalhousie University and recognize the support and mentorship from Dr. Lori Weeks within the School of Nursing and fellow co-authors on this publication. I'm going to share an outline of our systematic review protocol titled Transitional Care Programs in Canada for Older Adults Transitioning from Hospital to Home, a systematic review of text and opinion protocol. The focus of this review is understanding healthcare services available to older adults as they find themselves in transition between healthcare services. So we explore transitions between hospital to home. This means that when older adults require hospitalization, they experience a delay in discharge and are more likely to be assigned an alternate level of care status and then placed on a waiting list for long-term care instead of returning home. The need for a systematic review of text and opinion was evident when our research team was interviewing a small sample of health professionals across Canada that work within transitional care programs. So we could only find a handful of academic peer-reviewed articles, but from our interviews, we knew these types of programs existed, and provinces across Canada were really busy improving the services by getting programs up and running and developing pilot programs. There's a limited knowledge of transitional care programs in Canada, and local health regions could really benefit from sharing knowledge and information about what services already exist and the impact that transitional care programs are having by reducing long-term care waitlist and demand on acute care hospitals. Our review question was framed around investigating what transitional care programs exist across Canada for older adults to support them in moving from hospital to home, and what are the characteristics and outcomes of these programs. So our search strategy aimed to locate any gray literature published, including informal reports, websites, news media reports, and we used a two-phase strategy to search Canadian organizations and databases such as the Nurses Association, ProQuest News, the government and legislative libraries, and Canadian Institute for Health Information. Our second phase included an advanced Google search of all 10 provinces and 3 territories for any examples of local and provincial transitional care programs. So we limited our search to sources published after 2016, based on when the World Health Organization introduced the framework on integrated people-centered health services. And once we began our search, we quickly realized how onerous the process of searching gray literature was going to be. So a few key lessons we've learned so far is that gray literature sources don't have a descriptive or detailed title, and they don't have an abstract, which makes the first phase of screening quite challenging and cumbersome, as you have to go through the entire source to find any sign of transitional care programs. This means that the Google searches and source screening happened at the same time, and sources were exported to our referencing management software, Zotero. We found Zotero to be quite helpful for inputting reference information from every website into a folder we could later sort and keep organized. Then sources that were ready for screening had to be added to Covidence, where we began another screening process for the full text. Based on sources we found so far, there's limited information about program outcomes. Most of the information defining program characteristics has been found within websites. So this means we have an opportunity to narratively summarize the types of transitional care programs that exist. However, this creates a challenge when we're attempting to grade sources using a ConQual score for dependability and credibility. Our team looks forward to sharing the results of the systematic review and sharing insights about our experiences of adapting methods that have been developed for purely academic sources. So this means as information available continues to expand, so will the methods for synthesizing evidence need to expand. If you have any further questions or would like to connect with myself or Dr. Lori Weeks, please find our contact information below and our protocol published online with JBI Evidence Implementation. Thank you.